Even I am very much interested in knowing like how to get out of this under eye dark circles or the eye bags, or if I'm looking tired or something. So, is there any procedure, like a permanent procedure?
Yeah. See, there are a lot of problems which are around the eye. And see, eyes are one of the most important. The first thing you notice in a person is their eyes. So there are a lot of things which can be wrong with the eyebrows or eyelids or around the eye. So as you asked, like under eye dark circles and under eye this one, like if you feel that it is important, then what all can be done is there are a lot of creams in initial stages which help, and there are fillers like which fill up the hollow under the eye and which give you a fresher look, and there are lasers which take off the pigmentation under eye. And apart from this, if something permanently needs to be done, say under eye hollow to go permanently, we do what is called structural fat grafting and nano fat grafting, which gives more or less very long lasting permanent results. So this is what we can do for under eye. So whereas eyebrows, there are what are called microblading, like which will give more definition to the eyebrows. And many a times, like as we age, eyebrows sag. So that can be lifted. If it is very minimal, we can get a nice arched eyebrow and lift it with the help of Botox and fillers. Or we can do thread lift for eyebrow. So this is about eyebrow.
Okay. What causes this teardrop or the depression under the eye?
Yeah. See, teardrop and depression under the eye and under eye dark circles are many times hereditary. They occur because of sometimes lack of sleep and lack of hydration, and we should find out like what it is. And if it is anything to be treated, say something like an allergic this one or asthma or any this one, then we need to treat that also along with it, and then go and treat under eye problems. And as we age, when there is under eye bags, that is because of loosening of the fat which is around the eye. So for that, like what we do is a very simple surgery called blepharoplasty, where we reposition and tighten the eyelid and do a little bit of fat grafting. That gives a very good change when it comes to the lower lid.
Okay. If we see like Chinese or Asian, the eye structure itself is completely different, the lid structure. So nowadays, people are more into this cosmetology and all those things. So they do something called eye lid surgery.
Yeah. See, there are what are called droopy eyelids, or they can be very well corrected. Say this specific race of mongoloid kind of upper lids can also be corrected with the help of cosmetic plastic surgery. And many a times with aging, there is too much of drooping of the lid which obstructs reading and their appearance. So that also is done as blepharoplasty, where we address both upper and lower lids.
Okay. Who does this surgery though?
Yeah, it is best done by a cosmetic plastic surgeon. See, for few reasons, like around the eye, there are a lot of important structures, and things have to be handled very carefully. So somebody who handles tissues very delicately and who is trained with the anatomy around the eye, it is definitely cosmetic plastic surgery, which trains us to do such very delicate and precise job around the eye.
Okay. Apart from around the eye, is cosmetic surgeons do anything related?
Yeah. Cosmetic plastic surgeons also do reduction in the orbital volume. Or when it comes to squint correction, some of us do squint correction and stuff like that. And mostly what plastic surgeons do is called oculoplasty, that is rejuvenation of the areas around. There are a lot of tools. Say there are Botox, there is filler, and there are lasers, and there is fat grafting, and there are blepharoplasty surgeries, eyebrow lift surgery, endoscopic brow lift. So these are the things like which come under the cosmetic oculoplastic surgery.
So you can combine the procedure also, like for example, someone wants to go for eyebrow lift along with lid surgery and under eye.
Yeah. Usually it's not just one thing. Most of the times it's usually blepharoplasty with fat grafting, eyebrow lift with blepharoplasty. It's always most of the times it is with a combination of these things.
Okay. How does the procedure go, doctor?
One important thing about around the eye surgeries are they're all daycare. They can come and do and go back in the evening, and most of them resume work in 1 or 2 days, because we give a simple solution of wearing plain spectacles, and they can go.
So there won't be any swelling.
Very minimal, very minimal swelling, and very little bruising will be there, which will get very much hidden with the help of a thick rimmed plain glasses.
Okay. So what is the age gap between?
Yeah, normally under eye hollow and darkness like these occurs in younger people around 20s, 30s, and 40s. And as we age, these under eye bags and drooping eyelids and all these start appearing after 40, 50 years. And eyebrow lift usually I do for people around 55 to 60 years. It all depends actually how much aging they have, but these are the usual age groups who undergo such procedures. So for younger people, we do something more like filler and Botox.
But it's not permanent.
Yeah, it's not permanent.
Okay. What about the surgical procedure? For example, if someone has only a dark circle, which color correction. So is it necessary to go under the procedure?
Not necessary. If it is only color and we don't have to fill up, we can do a laser called Q-switch laser, which instantly takes away one shade from under eye. And this, if we repeat some 2-3 sessions, the results really last long.
Okay. But will it come again?
Under eye dark circles can come again. So it's important to understand what is the cause and to do the appropriate treatment. Okay. Just because you do filler, it doesn't mean that filler will not go, and you may have to repeat. So depending upon the situation and the need, we can tailor what is needed for them.
So what about the anesthesia you will be giving?
Most of the eyelid surgeries are done under sedation and blocks, regional anesthesia. Okay. And many times people are awake, and very few people, some 10-20% of people opt for a general anesthesia procedure.
Okay, so doctors, or how many doctors required?
Normally we need a team of doctors, one chief surgeon and nurse is good enough. We need a proper cosmetic plastic surgery operation theatre, and a very good anesthesia team.
Okay, so like who can opt for this particular thing?
Anybody who wants their eyes to look fresh and more youthful, they can opt for this. Usually the procedures are done for the later age group, and we do Botox and fillers for younger age group.
Okay, so any side effects, doctor, apart from since it is an eye area, so it can
it's the inner half of the eye, what we call the medial angle of the eye. It's a very delicate and sensitive place. So who are doing filler or fat grafting, they should be careful, because done by inexperienced people can cause certain serious problems like blindness. So it should be done by a very properly trained cosmetic plastic surgeon.
Okay. So is it a permanent solution, doctor? If someone is going under this surgical procedure, so will it stay?
Blepharoplasty is more or less permanent, whereas fat grafting and fat grafting lasts long. Whereas filler and Botox are not permanent; they're temporary, but they're like lunchtime procedures. You come, do and go types.
So any other checklist or any other things people should take in?
Yeah. Important thing is to understand what is the problem around the eye. Because somebody with a brotosis, that is falling brow, you do blepharoplasty, it is totally wrong. It will not solve the problem. So to get a proper analysis and consultation and come to what procedure will suit me, that's the most important step. And next step is my surgeon qualified and trying to do it? That is the second. And third is to do the appropriate thing. Say if filler and Botox is suitable for you, we should do that. If fat grafting is suitable for you, we should do that. So it's very important to choose which set of procedures will help us best.
Okay. Doctor, this is my personal question. Whenever we see a media, the cat fight between the celebrities. So people call another person as a plastic. So in plastic surgery or something, do they use any plastic or something?
We don't use any plastic in plastic surgery. The name plastic surgery has come because plasticos means to change the shape and to mold in Greek. So that's how the name plastic surgery has come. And when it comes to celebrities doing plastic surgery, there are two aspects to it. One is cosmetic surgery or any medical procedure is a personal thing.
Yes.
You want it some way, you want it and you do it. There is nothing about getting approval of others and others. So what we do at Nypunya is we keep it very confidential and discreet, and like the standards we maintain to the world standards. And most of the people like who blame others that they have undergone cosmetic plastic surgery, or they who condemn cosmetic plastic surgery, they would have undergone. And we are mature enough to just brush it off and say, okay.
So you are not using any material or something?
No. See, what we use, the fillers are called hyaluronic acid, which is medical grade, which is synthetic. And fat, what we use for fat grafting is your own fat. We process it and use it. So there is nothing like plastic being used here.
So how Nypunya is different from all
see, Nypunya, what we offer is an entire range. Say it could be simple Botox or lasers for periorbital rejuvenation, and we do advanced blepharoplasty and endoscopic prolip. So they get the entire this one. They will not be forced onto one thing because we have only that. Most of the places, what happens is they are done like what they have. It is not what is needed for that particular situation, for that particular client. So what at Nypunya, like we choose from this wide range of things we have, what is best for them, what works best for them. So that is how we choose. That's how Nypunya is different.
Thank you so much.
Thank you so much.